Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. When it comes to heart disease in India, the statistics speak volumes. In the last 2 decades, heart disease has become the leading cause of death in the country, with a quarter of all deaths due to various cardiovascular diseases. Even worse is the fact that the disease hits us Indians in our most productive middle years. It is possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide immediate CPR. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR and highlight the role of CPR in saving a life. And it's time we take our heart health into our own hands and progress to become a healthier people. Today we have with us eminent cardiologists who can help you understand sudden cardiac death as well as the role of CPR to revive and save a life. We're joined by Dr. Debadatta Bhattacharya, Senior Interventional Cardiologist, NH Rabindranath Tagore International Institute of Cardiac Sciences, Kolkata. Dr. Jabir Abdullakutty, a Senior Consultant Cardiologist, Director of Clinical Research, Lizzie Hospital, Cochin. Dr. Rohit Parti, a Consultant Cardiologist, Alchemist Hospital, Chandigarh. And Dr. M. Kathiresan, Senior Consultant Interventional Cardiologist, Apollo Hospitals, Apollo Speciality Hospitals, MK Heart Clinic, Chennai. Thank you so much, doctors, for joining us on the program today and to create awareness about heart health. Dr. Bhattacharya, first to you. Mr. David Ahaya from Bangalore has written that he has diabetes as well as dyslipidemia. He takes medicines regularly. What should he do to reduce the risk of a coronary artery disease?
So thank you for that question. Diabetes and dyslipidemia is a very common association, and these patients, as they grow older, they have a greater risk of coronary artery disease. What needs to be done in these patients is to control their diabetes levels properly and their cholesterol levels properly. For this, they have to take their medications properly. They have to have a balanced diet as prescribed by the diabetologist and a regular physical exercise, at least 150 minutes per week. And apart from that, if they're overweight, they should lose weight, and that in itself results in control of diabetes and dyslipidemia. And finally, they should give up smoking if they are a smoker.
All right. We have another question to Dr. Abdullakutty. Purushottam Reddy from Madanapalli has asked whether the main cause of high blood pressure is thickening of the blood.
It's not thickening of blood. Actually, this is the pressure that is exerted on the walls of the blood vessels due to various reasons. But the predominant reason we do not know, we call it as primary hypertension in 95% of the cases. There are certain cases where blood pressure can be due to a secondary disease, like renal diseases, kidney diseases, or some diseases where excess hormones are produced, or something like a obstructive sleep apnea syndrome, where the patient has recurrent bouts of obstruction to his breathing during the sleep, which he himself may not know, excess alcohol, certain drugs. But of course, it is not due to thickening of blood, rather it is due to the excessive pressure on the walls of the blood vessel.
Right. Dr. Kathiresan, we have a question from Mr. Mahesh from Hindupur who asks, is there a connection between LDL, triglycerides and high TSH?
Yeah, greetings to all. Basically, TSH increase means hypothyroidism. So the thyroid gland is functioning at a lower level. There are 5 components of cholesterol, what we call the fasting lipid profile. But the main component which looks at the relation between hypothyroidism and cholesterol is triglycerides. So there may be a greater variation of triglycerides, high triglycerides and hypothyroidism. The other component of cholesterols like LDL, total cholesterol, HDL may not have much changes with the thyroid levels. So, and triglycerides also increases with your poor diabetic control, as said by Dr. Jabir. Thank you.
Dr. Parti, what is the difference between good and bad cholesterol, and can a person lower the risk for heart disease if he or she lowers their cholesterol levels?
Actually, there are three components, main components of cholesterol. One is HDL, that is high density lipoprotein, and then LDL, low density lipoprotein, and triglycerides. So HDL is considered good cholesterol as it carries the cholesterol to the liver, where it can be removed from your bloodstream before it builds up in your blood vessels. And LDL takes the cholesterol directly to the blood vessels, so which can form as a plaque or a clot and can cause heart attack or strokes. And triglyceride acts as unused calories that are stored in our blood in the form of fat. These are triglycerides. So the optimal level for LDL should be less than 100 milligram per deciliter, and the patients who have previous heart disease or diabetes, it is less than 70, and for triglycerides it is less than 150, and HDL, that is good cholesterol, should be more than 50. So when we decrease our total blood cholesterol level by 10% by exercise or diet or with drugs, it decreases our risk of heart disease by 30%.
All right, Dr. Bhattacharya, now heart attacks has remained a major health concern around the world, but it's only recently that a rising number of heart attacks among the younger population are being reported or focused on. Why have heart attacks become so prevalent in younger people?
This is a very important question. As we are a young country, we have a lot of young people around. Now, unfortunately, there has been a radical change in our dietary and lifestyle, like sporting activities. Nowadays, children do not play outdoor games. They are more interested in video games. As a result of that, we have seen a steep rise in childhood and adolescent obesity, which spills on to the 30s, 20s and 30s as hypertension, early onset diabetes, which are important risk factors for coronary artery disease. And there has also been an increase of the incidence of smoking in young people. So this is a very fatal triad, and as a result of which, heart attacks which used to occur in the 50s and 60s is now increasingly occurring in the 40s, 30s, and even in the 20s.
All right, Dr. Abdullakutty, people often undergo surgical treatments such as angioplasty or coronary artery bypass surgery to remove blockage from the blood vessels and to restore blood flow to the heart. And they think once this surgery is done, then the problem is resolved. So what is the reality of this?
Look, this disease is produced by a process called atherosclerosis. This is a slow progressive process which progresses throughout the lifetime of the patient. At some point in the trajectory of this disease, patient develop a serious problem like a heart attack or serious blockages, which needs a bypass grafting or a percutaneous coronary intervention to deal with the immediate complications of this disease. But there is no absolute cure for the process that is leading to this disease. The process will continue despite angioplasty or bypass surgery. So these people are likely to develop problems in future unless they take the drugs properly. So coronary artery bypass grafting or percutaneous coronary intervention, that is PTCA, is not a cure for this disease. It prevents complications, it prevents problems. So to prevent a future problem after angioplasty or bypass surgery, they have to continue the lifestyle modification. They should continue the drugs. Certain drugs should be taken lifelong. Their cholesterol should be controlled, LDL below 55. The blood pressure should be controlled to a level of at least less than 140/90. And their diabetes, if they are diabetic, that should be controlled. And so certain drugs for lifelong.
All right, Dr. Kathiresan, many people die due to cardiac arrest during sleep without major symptoms. Do people ignore mild symptoms, or is it just that they haven't got any warning at all?
Yeah, this is becoming an increasing problem nowadays. So actually, the most important thing is most of the sudden cardiac death gives clue before. Only minority may not have any symptoms at all, but even those cases we can find out by undergoing regular health checkups. But most of the sudden cardiac deaths are due to acute myocardial infarction, what is called the heart attack. But there are certain disorders in the heart which look at the rhythm. So what we call rhythm disorders, conduction disturbances, channelopathies, which will cause rhythm problem in the heart. That also can cause sudden cardiac death. But these people who have rhythm disorders, most of the time they have a family history where one or two family members, immediate family members, would have died a sudden cardiac death before the age of 55 without smoking history. So when there is a family history of sudden cardiac death, or if you have any mild symptoms like breathlessness on walking, mild discomfort on walking, we can find it out the issues by doing regular muscle checkup. And exercise endurance, now most of the physical activity is coming down. So people who do not have a good exercise capacity they have to make sure that not only the food habits but exercise capacity has to be increased.
All right, well, with that, we'll slip into a short break, but don't go anywhere. We have many more questions for the doctors. Do stay with us. Welcome back. You're watching Health and Wellness, and we're talking about heart health. Dr. Parti, now, as most people still don't know the difference between a heart attack and sudden cardiac arrest, many people mistake recognizing the symptoms. How do you know if it's a primary cardiac arrest?
Actually, heart attack and sudden cardiac arrest, people use this term interchangeably, but it is not like that. Heart attack is a circulation problem and sudden cardiac arrest is an electrical problem. So heart attack occurs due to sudden blockage of one of the blood vessels which supplies heart itself. So when it gets blocked 100%, the blood supply to certain portion of the heart becomes suddenly it becomes zero and patient gets a chest pain. And in what happens in sudden cardiac arrest, there is sudden dysfunction of electrical activity, the pumping, and the heart suddenly stops beating, and there is diminished blood supply to the vital organs. So what happens in a heart attack? One will have typical symptoms of chest pain, sudden breathlessness, and in sudden cardiac arrest, it will come out of the blue. There will be no warning. First sign of the problem will be passing out and becoming unconscious. So what happens in heart attack? The heart continues to beat, but with time, if the treatment is not given, the certain part of the heart muscle becomes dead. But in sudden cardiac arrest, the heart stops pumping and there is no blood pump into the vital organs. So how do we respond to a heart attack? For heart attack, just call for some medical help, give aspirin if it is available with you, and immediately transfer the patient to the hospital without delaying for primary angioplasty. But in sudden cardiac arrest, please don't waste time, just call for help and start cardiopulmonary resuscitation, or you can give an electrical shock if defib device is there, which is sometimes available in big like marketplaces or in bus stands. So the need of the hour is to teach the community about the cardiopulmonary resuscitation, or maybe in high school level we should teach our young students about the cardiopulmonary resuscitation. So this is the difference. Heart attack, you still have time, but in sudden cardiac arrest, the bystander available, the normal person available near the patient has to respond and has to start cardiopulmonary resuscitation to save precious lives.
All right, Dr. Bhattacharya, lack of CPR awareness is a big health challenge in India. So please tell our viewers about what are the main steps of CPR.
Yeah, thank you very much. I think what we need to understand is that just teaching the CPR skills is not a big thing. And anyone who has passed class 10 with a basic idea of biology can be taught this. And I'm just going to tell you why. So if you find someone unresponsive by the street or in the rail station or in an airport, what you need to do is to go and see whether they're rousable or not. Call out their name, shake them up. If they are not rousable, then the next thing that you do is check whether they are breathing and check whether they have a pulse. And if that does not happen for 10 seconds, then place them on their back on a firm surface and start chest compressions at the rate of 100 to 120 beats per minute. And while you're doing that, at the end of 30 compressions, the patient needs 2 rescue breaths, which you can give by mouth-to-mouth respiration. And you can just, if you do this, a lot of these patients will be rescued from brain damage. And you can, while you are doing this, you can call for help. Other medical personnel, paramedics can arrive on the scene. And a lot of lives will be saved. And so it is very important that we teach our young people how to do this. And class 10, class 12, when they go into college, you can have a basic life support skill which can be taught to you.
All right, Dr. Abdullakutty, how long does it take to recover from a cardiac arrest and what are the treatment options then?
It all depends upon where does the cardiac arrest occurs. It can be out of the hospital or inside the hospital. If it is inside the hospital, the chance of survival and recovery is quite high. If it is out of the hospital, then it depends upon whether it's a witnessed cardiac arrest or it's a non-witnessed cardiac arrest. If it is a non-witnessed cardiac arrest, very unlikely chance for him to recover. If it is a witnessed cardiac arrest, and as Dr. Bhattacharya told, if they receive a proper cardiopulmonary resuscitation, a shock within a span of 5 minutes, most of the patients within a span of 5 minutes, they will recover. If they don't receive a shock or they don't receive a proper CPR, most likely permanent brain damage occurs within a span of 5 to 6 minutes time. Then, once the patient gets a good cardiopulmonary resuscitation and shock, because now shock machines are available in many of the public spaces. So if shock is received, CPR is received and patient transported to the hospital, 25% of the patients usually recover immediately. Around 70% patients recover in 24 hours of time. And 90%, those who recover, 90% of the patients recover within 3 days time. If they don't recover in 3 days time, unlikely to recover. A large majority of out of the hospital patients we lose. By the time they reach the hospital, they are still unconscious. Those patients who are still unconscious, a large number we lose. In hospital cardiac arrest, they receive proper treatment, they receive the resuscitation, shock and drugs on time because doctors are around, the facilities around, so large number survives. Despite all these things, we may lose the patients because the underlying disease may be bad. So it all depends upon whether it is in-hospital cardiac arrest, out-hospital cardiac arrest, whether they receive the CPR on time, shock on time, and the rest of the treatment, the rest of the we call it as advanced cardiac life support and further treatment. So that's where it's important to have public, it's important for the public to know about the cardiopulmonary resuscitation, how to give a shock. So in a public space cardiac arrest, if some person can initiate the cardiopulmonary resuscitation and give a shock on time, you can really save the life. That is what your message also.
All right, Dr. Kathiresan, does taking painkillers increase the risk of a heart attack or stroke?
So
Yes.
first of all, what we have to understand is most of the painkillers are generally safe. Millions of patients take painkillers daily. And what we have to understand is in certain subset of patients like refractory hypertension and patients having previous renal kidney dysfunction, certain groups of painkillers may increase the blood pressure and can cause further kidney damage. So even in those cases, it is reversible. So what causes the notion is in those subset of patients where they have a pre-existing condition of increased blood pressure or kidney dysfunction, these specific subset of groups of painkillers can increase the blood pressure and can cause a stroke. But still, in our country and all over the world, most of the heart attacks and strokes are caused by pre-existing risk factors like blood pressure, diabetes, cholesterol, smoking, and poor exercise, lifestyle modify things. So specifically, certain COX inhibitors and NSAID groups of drugs can increase your blood pressure or can cause a transient temporary renal damage, which can translate into heart attacks or strokes. But by and large, painkillers are safe.
All right. And Dr. Parti, how does heart disease affect women differently from men?
Good question. Actually, women are protected from heart disease till the menopause, and but it is not always true. We have seen women having a heart attack in late 30s and early 40s. So the first heart attack in females occurs 10 years after a male, maybe 10 years older. So there are risk factors which are different for heart disease in females. Normal risk factors like diabetes, high blood pressure, high cholesterol are same with the males, but endometriosis, polycystic ovarian disease, and diabetes and hypertension, which occurs during pregnancy, are added risk factors. Once they achieve menopause, their risk doubles than males. The typical symptoms of heart disease like central chest pain are lacking in women. They may have little chest tightness, atypical symptoms, upper abdominal pain, some breathlessness. These symptoms are different in females because females have smaller arteries of the heart. The coronary arteries are smaller. They may sometimes the disease may be missed on even the conventional angiogram because they have more of a microvascular disease. There are some tiny vessels which even we cannot see on the angiogram. And women tend to do worse than males after they suffer heart attack. So their stay in the hospital may be longer and they may die more often than males even after treatment. And women are more likely to suffer second heart attack. This is because sometimes women don't take proper treatment after first heart attack, and due to some socioeconomic status in India, women don't take proper care even after first heart attack or second heart attack. So mortality is more in women.
All right. So that is something people need to be more aware about. Thank you so much, Doctor. We're completely out of time. Thank you for joining us and talking about these very important issues. Thank you for watching at home. Goodbye.